Good morning. We are doing oral histories for the upcoming exhibit celebrating nursing in the Upper Cumberland. It is opening on March 30th, 2019. Thank you for being here. If you could, for the record, just give us your name and hometown.
My name is Lynn, and my hometown now is in Salina, Tennessee.
Okay, excellent. Now, how long, Karen, have you been in the nursing profession?
Well, I graduated in 1982 in the very first class from Tennessee Tech. Before that, I had worked as a nursing assistant and an emergency medical technician, but I earned my BSN in 1982.
Awesome. Now, can you just tell us a little bit about, kind of how your career progressed and what did you do when you graduated and up until now?
Okay. Well, I started in the hospital, as so many nurses do. I had already been working there for about 7 years as a nursing assistant and EMT and learning things there. So I went back to Carthage General Hospital when I graduated as a charge nurse. And in 1983, early 83, I went over to the Department of Health. And I worked with the Department of Health for 32 years in various roles. I worked out in the clinic. I did nursing education out in school systems. I went back to school. I was lucky, and the state helped fund my graduate degree, so I earned my master's in nursing from Vanderbilt in about 1989. And so I went back as a nurse practitioner in the Department of Health and did primary care. And the last 10, 11 years I spent as the emergency response coordinator for our region. So did bioterrorism planning and response to disasters, whether it was like the fungal meningitis outbreak or working in shelters from floods and ice storms and things like that. So I did lots of different things.
Wow, that's a consistent theme that we've heard throughout these interviews is just the huge variations of career opportunities that nurses have.
Oh yes.
Don't know if a lot of people realize that.
I don't either. Everything from home health to hospital nursing to working with drug companies and public health, all kinds of different things, surgery centers, and you can just go on and on and on at the different things you can do as a nurse.
Yeah, that's really amazing. What a great career for young people today and for young people in the past.
So, it is.
What are the best and worst parts of nursing in your opinion, Karen?
The best, I think, is the interaction with the patients. It feels so good. In the hospital, you get to see them get well. Not always, but then you're there for the family. See, it brings tears to my eyes. In public health, sometimes those rewards are long-ranging. When you do vaccinations, for example, and you see those kids that you gave childhood vaccines live to be in their 20s and 30s and 40s and have their children because they didn't die from the vaccine preventable illnesses that we did when I was a child. There's all kinds of rewards, but working with the individual patients or clients, depending on what kind of nursing you do, is what makes it so rewarding. Worst? I don't know. I can't think of anything that I would consider the worst. Maybe in this day and time, maybe just not having the time that you want to give to those individual patients. Everybody's so swamped. The staffing's different than when I graduated, I think, and I think probably you don't feel like you get to do as much with one-on-one interaction with that individual and their family, helping them.
Yeah. So what are the biggest changes that you've seen since you started? And also, if you wouldn't mind incorporating a little bit of the Tennessee Tech aspect of that, since you were in the first class, I'm sure that's seen vast differences.
Yes,
massive things.
Well, when we started, we were very small. Just maybe 30 of us in that first class. I can't even remember the real number now, but we were the only one. It was kind of a shock to the campus, I think, when we came out with our huge loads of books and our 5 o'clock in the mornings heading to clinical that other students didn't know what to do with us. But it was great. It was fun to begin there in the beginning. I think, first of all, uniforms, just the way we dress. We started with our little white caps and our white dresses, and now nurses wear everything, mostly scrubs, I think, in the primary care arena, and even in public health now. We used to wear navy blue and blue and white pinstripes in the summertime.
Well, and you were saying about the caps that they were indicative of different things.
Yes, if you were a licensed practical nurse, an LPN, you wore a green stripe on your cap. If you were a registered nurse, you had a black stripe on your cap, and that's how people could tell the difference. And what, besides your name tags, of course, that's in what we were doing. That's a real simple thing. I think I wrote down notes because there was such an explosion in knowledge and technology. When I graduated, sure, we had some IV pumps and you had different things, but a lot of it was still your old-timey stethoscope and your blood pressure cuff and your gut feeling that something was wrong with patients. You didn't have all the machinery we do nowadays and the technology that I've been out of it long enough now. I don't even know what all's out there, but explosion in the number of medications and treatments and just all that. I think too, there's a change in the acuity level, how sick patients are before they can even be in the hospital and how quickly you have to move patients out. We used to, when I graduated, we could leave somebody who had a gallbladder surgery in the hospital for a week.
Wow.
Or a C-section for a week. And now it's maybe an outpatient procedure and you're out the door and ready to go. And there's pros and cons to that, I think, especially when you think about little people who may not have any help at home and or don't read well and don't understand instructions well. You don't have quite as much time to teach and to work with that family to get them ready for that transition. So I think that's different, that patient acuity and the staffing differences that brings on. More nurses than ever are going to advanced practice, whether it's clinical nurse specialist or family nurse practitioners and different kinds of advanced practice. PhD nurses more common now than they were when I graduated. It was even when we graduated, there were very few BS prepared nurses, Bachelor's of Science nurses here. A lot of it was diploma and associate degrees. So it was kind of different. It was kind of scary in the Upper Cumberland to see us come out and not know what we were going to be like or what we were going to do differently. So much research, so many changes in that. Insurance, I think, drives a lot of what happens in healthcare now and what you can do and not do with patients, and I think that's somewhat different, maybe a lot different than when I graduated. It was important, obviously, but it didn't drive as much of what you did, I think, as it does now. Public health, which is a different perspective probably than some of the people you've talked to, has really changed too. The concentration with more vaccines, more to offer in terms of that kind of thing that can protect people from illness, primary care options in public health that we didn't do a long time ago. We did in this region, but they didn't in others. Emerging infections, I think that's a big difference. Antibiotic resistance, things that we're battling now that I didn't dream of in the 80s. When I started working in a hospital, HIV hadn't even been discovered yet. So lots of changes in those kinds of things. Who would have dreamed we would have been worried about Ebola in the United States a couple of years ago?
Yeah.
So emergency preparedness type stuff is a lot different now as we look at world security, the security of everything. All those things that we didn't used to deal with when I started. Lots of differences, actually. It's hard to even list them all.
Yeah, well, it's just a different world, It's amazing what, it seems like yesterday, but 30 years, the 80s were 30 years ago.
Yeah,
so
37. I added it up and went, oh,
yeah.
that was a long time ago.
In a couple of years, well, next year, those kids that were born in 1980 are going to be 40 years old. So, I mean, it's hard to imagine.
It is hard to imagine. and the changes, some are good, and some maybe I sit back and think, well, maybe we're not doing so good. But
yeah.
But that's life. It changes.
That's right. Well, thank you so much for coming in and speaking with us today. Do you have anything you'd like to add?
No, I thank you for doing this exhibit. I think it's really exciting to highlight nursing, and it means so much to a lot of people, I think.
Well, thank you. And you're right, it does. The nurses are a very important part of our community. So thank you so much.
Thank you.